All right, let's start this surgery. Alexa, today's top hits. Scalpel.
Better than birds of a feather, you and me. We change the weather. Yeah, I'm feeling heat in December when you found me. I've been dancing on top of cars and stumbling out of bars. I follow you through the dark, can't get enough. You're the medicine and the pain, the tattoo inside my brain.
All right, perfect amputation of the left leg.
Left leg?
Left leg, right?
It was supposed to be her right. Or
No.
left. Her right.
Okay, well, that's okay. We'll just cut off the other one. Scalpel?
Okay. You're the doctor.
Why is there not a procedure to prevent this from happening?
You would think there'd be a better protocol for this.
Perfect.
I wear glasses, I don't see. Oh my gosh, where are my legs? Nurse, please help. I need to call my lawyer.
That's not okay to accidentally cut off a patient's limb or have a mistake in the surgery room. I definitely hate to be the doctor having to explain to the patient what happened. Well, in 2004, the Joint Commission was fed up as well, so they decided to implement the universal protocol that includes the surgical timeout. So I know you're probably wondering, what is a timeout? Well, it's not a discipline action for your child or a break in a sporting event. The surgical timeout is the final step before the surgery to confirm the accurate patient identity, surgical site, and planned procedure. Now, let's take a look at what it includes. So, surgical timeout. What does it entail? 5 simple steps. The first part of a surgical timeout is important for all staff members to stop, identify, and state their role in the surgery. Next, they're going to confirm the patient, site, and procedure. Then we're going to see that there's no other concerns that anyone has. We're going to ask if they received any antibiotics, and then we are going to make sure the proper images are displayed for there's no mistake during surgery.
Thank you, Tori, about teaching us what the timeout protocol is. Now let's have Gabby tell us about some articles with the evidence-based practice behind it.
Timeout is extremely important for patient safety and ensures that no mistakes are made during surgery. The first article, Timeout in the Operating Room, the author tells the story of a patient who was having surgery on his right side before timeout was implemented, but because of a mistake, the patient was positioned for the left side surgery. Luckily, the nurse double-checked and caught the mistake before the doctor cut into the patient. Timeout ensures that mistakes like this are avoided and the medical malpractice are reduced. Another article, National Safety Goal Timeout, the author indicates that the procedures that place the patient at the most risk are general anesthesia and deep sedation, which is why it's important to perform the timeout prior to any major procedures in order to make sure mistakes are avoided. A third article, 5 takeaways from surgical timeout success, explains the importance of conducting a timeout before surgery procedure. This is done to ensure that no mistakes are made on a person, site, or site. Even with this timeout in place, there are still mistakes due to the lack of participation for the whole team. So, this is an evidence-based practice.
The purpose of this goal is to prevent never events. What's a never event? Well, you're in luck. I'm going to tell you. A never event is theoretically 100% preventable and should never, ever occur. These never events include surgery on the wrong patient, doing the wrong procedure on the right patient, or performing the surgery on the wrong site during the surgery. Basically, they are making a mistake during surgery, and that shouldn't be happening because we're supposed to check the right patient the right procedure, and the correct site. So, with these rules implemented and the timeout protocol, there should be a zero tolerance environment for surgeries.
Our role as a nurse for the timeout protocol is to call out for timeout. We're going to ensure that all activity is suspended, that there's no distractions, and our focus is purely on the timeout. During the timeouts, we're going to have everyone introduce themselves and name their role in the surgery. Then we're going to have patient name identification. We will have this verified with the chart and their wristband, as well as their date of birth. Then we'll make sure that we're doing the correct surgery, that we have the correct site, and that we have our patient in the correct position.
Yes.
Hi there.
Hi.
Nice to meet you. I'm Dr. Siemens and I'm your surgeon today.
Okay.
Can I have you confirm your patient name and date of birth?
Gabriela Humada, 1194.
Perfect. Okay. And
And I'm Heidi. I'm going to be the scrub nurse, and I'll be
Okay.
there assisting her the whole time.
perfect. And before we get started, I just want to go over and make sure that we know exactly what the procedure is. So we're going to be doing a total left hip replacement.
Yes.
Is that correct?
Yes.
Perfect. And so I'm just going to check out the site. Everything looks good.
Marked and everything.
Yeah, there's a good mark. Yeah, my initials are there. Do you see that?
Yes. Yep.
Okay, so perfect. So the next time we see you, it's going to be in the operating room.
Okay.
We're going to go get ready.
Thank you.
You're welcome.
Do you like your footrest, ma'am? I'm sorry. I'm just wheeling you, and I didn't know.
Well, now that we have a protocol, I can do surgery again.
You ready for surgery now?
Yes.
All right, let's position her.
Oh, she's hot but a psycho. So left but she's right though. At night she's screaming, I'm on my mind. She'll make you curse, but she your best.
Love the song.
Within a second, you'll become a man. Back for second, with your play, you just can't help it. Oh,
All right, are we ready to go?
play along.
Yeah, I'm ready.
We do our timeout first.
Okay, Alexa, music off.
All right, I have here female Gabriela Humada, date of birth January 1st, 1994. She's here for a total hip replacement on the left side supine position.
Perfect.
Confirm that with everyone.
Yes, we have our patient, Gabriela Almada. She is here for her left hip total replacement and put her left hip in the supine position.
Yes.
Perfect. And patient was given antibiotics and we have the proper imaging displayed. And I can confirm that I have my proper markings on the site of incision. Do you confirm?
Yes, proper markings, correct side.
All right, let's do this. Alexa, today's top hits. Scalpel.
Said she tired, little money, need a big boy. Pull up 20-inch blades like I'm Lil Troy. Now it's everybody flocking, need a decoy. Shorty mixing up the vodka with the liquor. G-Wagon, 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 G-Wagon. All the housewives pulling up. I got a lot of toys. 720S bumping Fallout Boy. You was talking shit in the beginning. Back when I was feeling.
Today's hit jams. And let's start the surgery. Scalpel.
I'm not sterile anymore.
Okay.
Guys.
Guys, it doesn't matter.
I mean, I was trying to act.
Good job. I can't do this. I can't do this.
I was doing this.
Not laugh. Please. Just get it out. Just let it all out.
Okay, I'm ready.
Okay. Would you like your footrest? Sorry. Victoria!
You need help?
Okay,
Do
okay.
you want to be the nurse?
No, because I'm going to laugh no matter what. Okay, go again.
Gabby's just having.
Gabriela Humada, first 94, 19.
Time out. If I did it like in that accent the whole time.
Yes. God.
What the heck? It was a knock.
Ever happen. That's what I should be like. Ever. Never. Never. Okay. It's a movie. Oh. We're rolling.
As a nurse, our job is to call for the timeout, right?